are basically that type of effect, okay? So for arch taping, we want the foot in kind of a little bit of plantar flexion, just kind of relax like this, because everything we do with the arch when you go to plant, it's going to pull the heel up, and it's going to pull this arch up. So they really work well. I like orthotics better, but there's a couple things we can do in the taping of the arch. Typically what I'm doing here, and it's a little tougher on this because the feet sweat quite a bit, so we kind of have a anchor strip here. That's where I'm going to connect them from. So if I look at here, I'm going to connect. There's different patterns. There's X patterns, there's a teardrop pattern. So I can go from here, around, back to the start, here, around, back to the start. Then I continue to do that and I fill in this little V in here. Typically we'll do it with half strips or partial strips, like this. We'll go here, as I get in the way there. So I'm here, wrap it around, come back through and back to the start, and tear it right there. Okay. I do that again on the opposite side. Here, wrap it around, and back to the start. Now I continue to do that until this is filled in. Okay. So typically here, there. You guys see? We didn't come around if you can see this.
I can see it on our phones.
Yeah, okay, sorry.
I'm good.
So I'll probably do one more right there, okay? Then I'm typically going to probably anchor around again, around the toes, around the foot. I'm probably going to anchor coming from lateral to medial. Okay. And probably like that. Now, when she pull,
Yeah.
okay, when you step like this, this is going to pull the heel. And if it's anchored here properly, I would typically spray this really good with a good adhesive, QDA. And then when I do that, I can, when that pulls up, it's going to create this arch. Okay. The one thing I would talk about right here, this is moleskin right here. I would cut a piece of that off and put it back here and then tape over it, because this is where that tape will eventually start to rub and create a blister there. You put the moleskin back there and do it there, you'll be better off. Okay. So this is one tape that we can do like that. Kind of an X taping. You can do it that direction. You can also, your book will show different ones as well. You can actually go from inside here like this, around, and so kind of an X tape like this. So you're going from one side to the next and keep filling in. That's another way to do it as well. And so in any case, what I typically do is after the X's, series of X's, fill it in, and then I probably use my Power Flex, where I can Power Flex it and keep it good and solid there. That way it's not sliding and it conforms real good. I don't want to get it too tight, but it conforms really well. So you step down on that, you can see that. So a couple different forms of X taping there for the arch. A couple others. Take this off. See if we can disassemble this a little bit. Okay. One real simple one you probably won't see in your textbooks, based on, loosely when I was in the clinic, one of our clinicians actually just kind of based on McConnell taping, using the McConnell tape that we have, was the Leuco tape, which is very, very sticky. This is the one application where you can use it on the foot, and I wouldn't leave it on there for lengthy amounts of time. But I can support the ankle, and I can support the arch. So I typically have the ankle up like this, and this is really sticky, 2 strips of tape. I come over the tibialis anterior to kind of use it as an anchor. I bisect the calcaneus and I pull it up. Then I come over to the other side of the tibialis anterior, and that's going to support my ankle. Okay? Now, so that would be more of kind of that stable heel cup type thing. Now, come over the tibialis anterior again. The styloid process, I want just under it and right where the navicular is, right there for my arch. I come up over the top, pull it, and there I go. Okay, simple. If this helps, I typically will want to get them in an orthotic. I like to put them in orthotics. I don't like doing this. This is $6 a roll. It's not cheap. And so this particular tape, I call it a McConnell arch tape. So you go from medial to lateral and lateral to medial. 2 strips of tape. That's all it takes. Okay, pretty easy. Okay, another one, 2 more to show you. One more on the arch and one on the turf toe. So in this one, you know, you can keep it on for practice, but I would get it off of there. It can. It is so sticky.
Nails.
And even with sweaty feet, it is very, very tacky.
So would you still use the pre-spray?
On this one, probably not. Probably wouldn't need to, but the other tape, the white tape ones, yes. Now, I can use, this is really a turf toe, a pre-cut turf toe strap made out of moleskin. This is a regular moleskin. So if I didn't have this, I could use this if I wanted something a little wider or longer. But I'm going to show you actually with this, so I don't use my turf strap for the other one. Here. So if I cut here, I'm probably going to just leave this a little bit. So this would be called a low die. Using this. So same principle. Okay, a little bit of plantar flexion. I use the teed off area to go around the heel. So I anchor it to the back of the heel. Then I pull it up here, right there. So I've got it anchored on there. Cut off my excess. Lose any toes. Okay. There. Now what I would probably do from this is use my stretch tape to secure it down. Pretty simple. Now when I do this, feel the pull.
Yeah.
It pulls the heel, creates that windlass effect, and supports that and brings the arch up. Very effective. This one can be pretty simple. I like this one. I like this one. In a pinch, I can do the other ones as well. They just take a little more practice. Just kind of giving you some ammunition for your arsenal there for arches. Okay. I can also take a pad in any one of these. I take the foam pad, adhesive pad, 1/4 inch or 1/8 inch, depending on how thick I want it. Cut a half moon pad, put that in there right there, wrap it on with my flex tape. I can help support the arch up a little bit better by doing that in conjunction with any one of the tapes that I just did right there. Okay? Pretty easy there. Okay, now the last one is the turf toe. What hurts a turf toe? What is a turf toe? Sprain of the big toe. Okay. What hurts it the most? Yep, extending back like this. She has a little bit, her toe comes in a little bit, which would be kind of a hallux valgus right here. And so we kind of want to keep that here, but I don't want it to come back. I want to prevent that a little bit. So typically what I do is I can use this turf toe strap, can put it on here, kind of on the bottom and on the side a little bit. Pull it down. Okay. by doing that. A little wrinkle in there, smooth that out. And I can do this to varying degrees, okay? I can pull it all the way down. If I want to get it really down there, I can pull the toe down a little bit, bring this up, secure that around. Now, I didn't bring any stretch tape in here. You can see how, when I do my stretch tape, I can also take and do a figure of 8 to support the joint around here. So I can do an X taping right in the joint area. Here. I do a series of those just to support that joint. Do this, and then take my stretch tape and go around this and around the foot. And now when she steps, it's harder, because of this, it's harder to extend and take some of the stress off of the sprained toe when we know that this is more painful. So if I have my stretch tape here, what I would do is start here, go around the foot, the ankle to secure it down, and I always pull downward. If I go the opposite direction, I'm actually pulling the toe back up when I come underneath. So I want to start downward and then go around to keep the toe down.
So you always go medial to lateral?
Always go medial. Yep. Okay. Actually, this would be more lateral to, yeah. Yeah.
Makes sense.
Okay. So turf toe, and then as you get into these, I've got other ways in which I do turf toes that I can show you later. The principle behind it is supporting the ankle joint with white tape, taking the turf toe strap and keeping it to where it's in a plantar flexed position instead of an extended or hyperextended position in there. So what I will do for Thursday is, when Peyton is in here, we'll have the tape out. I'll have